Good morning and welcome to your medical surgical nursing related learning experience. Now, before we start our lecture, may I ask you to bring a notepad and a pen for you to take down notes. The special field known as perioperative and peri-anesthesia nursing includes a wide variety of nursing functions associated with the patient's surgical experience during the perioperative period. Perioperative and peri-anesthesia nursing addresses the nursing roles relevant to the three phases of the surgical experience: the preoperative, intraoperative, and your post-operative. When we say preoperative phase, it is the period when decision for surgery is made and ends when the client is transferred to your OR bed. It also includes all activities that prepares the client for surgery. Intraoperative care is when the activities patient is transferred to OR bed until shifted to recovery room or post-anesthesia care unit. Post-operative, after admission to your PACU up to resolution of all surgical consequences or recovery from surgery. The surgery may be performed for various reasons. A surgical procedure may be diagnostic. When we say diagnostic surgery, it is a surgery that is done to verify a suspected diagnosis, or it can confirm a diagnosis. Example of this are your biopsy or your exploratory laparotomy. And then we also have your exploratory surgery. It is the surgery that is done to estimate the extent of a disease and may be done to confirm a diagnosis. When we say curative surgery, it removes or repairs damage, disease, or congenitally malformed organs or tissues. Example of your curative is your excision of a tumor or an inflamed appendix. When we say reparative surgery or a constructive surgery, it repairs a congenitally defective organ, thus improving its functions and appearance. Example of your reparative is multiple wound repair. We also have your ablative surgery. It involves removing a diseased organ. And then we can also have your reconstructive or cosmetic surgery. When we say reconstructive or cosmetic surgery, it is the partial or complete restoration of a damaged organ or tissue to its original appearance. Example of this is your mammoplasty or a facelift. When we say palliative, it is done to relieve symptoms, but it does not cure the underlying disease. Example of your palliative is to relieve your gastrostomy tube is inserted to compensate for the inability of the patient to swallow food. Categories of surgery based on urgency. First, we have your emergency. When we say emergent, it is where the patient requires immediate attention. This order may be life-threatening. Indications for surgery, it has to be without delay. Example of this is your severe bleeding, bladder or intestinal obstruction, fractured skull, gunshot or stab wound, extensive burns. While urgency or the urgent, the patient requires prompt attention. It has to be done within 24 to 30 hours. Example of these are your acute gallbladder infection, kidney or urethral stones. When we say required, it is where the patient needs to have surgery. So plan within a few weeks or months. Example of this is your prostatic hyperplasia without bladder obstruction, thyroid disorder, and cataracts. Elective, patient should have your surgery. It is performed for the patient's well-being but not absolutely necessary for life. Indication for surgery, failure to have surgery is not catastrophic. Example of this are your repairs of scars, simple hernia, or your vaginal repair. And the last is your optional. It is requested by the patient, not necessary for health. So the decision will rest with the patient. Indication for surgery, personal preference na siya. So example of this is your cosmetic surgery. Types of surgery based on degree of risk. We have your major surgery and minor surgery. When we say major surgery, it is with high degree of risk, may be complicated or prolonged, a large loss of blood with vital organs involved. Example of this is the removal of an abnormal or malignant organs such as your gastrectomy and nephrectomy. While your minor surgery naman, there is a little risk with fewer complication. So, example of this is your breast biopsy, removal of tonsils, and polypectomy on your nose. Major conditions that require surgery. First is your obstruction. If there is a blockage and it primarily affects your hollow structure. Example of your hollow structures are your arteries, bronchial tubes, and your ducts. When we say naman perforation, it is the rupture of an organ, artery, or ducts. Erosion, if there is a break in the continuity of the tissue surface. It is caused by irritation, infection, and ulceration or inflammation. And then tumors, they are your abnormal growths of tissue in the body that serves no physiologic function.